chronic condition is one that needs long-term monitoring or rehabilitation, or has symptoms which need treating over a long period of time. Examples of this in cardiology include patients with a heart rhythm problem who experience palpitations from time to time, or patients with a valve problem that does not require surgery or treatment but does require regular monitoring to see if the condition worsens. Patients who undergo surgery also often require long-term observation. I know this can be a bit confusing. Health insurance covers private care for things that doctors expect to respond quickly to treatment and get patients back to their previous level of health. For example, a fractured bone, or if someone has a heart attack. And these are known as acute conditions. Although health insurance covers the diagnosis and initial treatment of a chronic condition, it doesn't cover treatment and care of conditions when they become chronic or long-term. These include diseases, illnesses or injuries that either continue indefinitely, need monitoring, control or relief of symptoms and rehabilitation, or those that don't have a known cure or are likely to come back again. If you've got a chronic or long-term condition, it's important to have regular checks and sometimes tests. These aren't covered by health insurance unless you've got health insurance through your work and your employer has specifically added this. Regular checks and tests for a chronic condition can usually be done by an NHS GP or NHS consultant. Of course, if someone is particularly keen to see their consultant privately for regular checks and tests for their chronic condition, they can pay for it themselves. What this means for someone with a cardiac problem is that the tests to diagnose their condition, if it's a new condition, will be covered by their policy along with any initial treatment they may need. Often initial treatment doesn't completely cure cardiac conditions, so they become long-term or chronic and usually need regular treatment or monitoring. One of my patients came to see me in my NHS GP practice because he was having dizzy spells. After some initial tests, it was clear that he had a problem with his heart's rhythm. I referred him to a Bupa fee-assured cardiologist who did some more tests and treated him with a pacemaker. His policy covered this and a pacemaker check within 6 months of his operation, and I then referred him to his local NHS Cardiology department for the ongoing checks and monitoring. Another patient had chest pain when he exercised because he had angina. I referred him again to a Bupa fee-assured cardiologist who specialises in angina. The cardiologist ran some tests, confirmed the diagnosis and gave the patient some standard prescription pills to treat his angina. His chest pain disappeared and his cardiologist discharged him back to me, his NHS GP. The cardiologist asked for his blood pressure and cholesterol to be regularly monitored and if necessary his medication adjusted. My NHS practice nurse also gives him dietary and lifestyle advice, in particular advice related to exercise and stopping smoking. It's important that people monitor their chronic condition and have regular checks and tests for their condition. And we're not saying that people shouldn't do this. The reason why health insurance cover doesn't cover chronic conditions is because the monitoring can usually be done by an NHS GP or NHS consultant, so there's no need for it to be done privately. And this helps to keep health insurance premiums down. The way it works is that a private consultant will write to a patient's NHS GP or NHS consultant setting out a monitoring plan. If people, however, want to be monitored by a consultant privately, then they can of course pay for it themselves. If the symptoms do come back, our policies will cover treatment for a flare-up. So an NHS GP could refer someone back to their private cardiologist, or they could stay in the NHS for treatment. The choice is up to the customer. So what this means is that Bupa cover works seamlessly with NHS care. You can switch between the NHS and private treatment whenever and as often as you want, but always check with us first that your policy covers your private treatment. Your consultant and GP will be able to help you transfer between NHS and private treatment. If you've got any questions or would like to talk to us, please call your Bupa helpline. You'll find the number in your membership documents. We're here to help.